Curious, as Beijing, as China broadly continues to see the sort of other side of the virus pandemic, as the recovery and the economic recovery continues, are you still seeing similar numbers of demand for your service?
Yeah, certainly. We definitely found that the COVID-19 patients or suspected patients were in desperate needs in consulting doctors mostly from online hospitals. Also, the offline hospitals were still packed with patients. Plus, people were afraid of going to hospitals due to the possibility of getting cross-infections. So during the outbreak, we were the first to launch free online consultation for Wuhan City, done to the entire nation in an effort to alleviate pressure on overburdened hospitals and to curtail the further spread. So our doctors worked day and night, and with the AI assistant, we're able to provide 300 consultations per doctor per day. So that's the first finding. Yeah, also saw a huge surge in drug refill demand from chronic disease patients, such as diabetes, asthma, cardiovascular disease patients. So our new chronic disease patients tripled. So we were able to launch free refill service for chronic disease patients on our platform. Also, we applied and received a Green Channel logistics permit from the Central Epidemic Control Commanding Center. Thus, we were able to deliver drugs to users living even in the epicenter during the lockdown period. So during the break, we found interesting things. For example, we saw a very sudden surge for the search of certain keywords. For example, the face mask jumped 170 times. Rubbing alcohol rose 400 times. So our application app downloads have been ranked at the very top among the internet healthcare category, with new users five-folded. So work very closely with our strategic partnering pharmaceutical companies, right, on the urgent needed drugs and medical supplies meet the exponentially growing demand.
Right. Do you expect that the way people treat health and seek health advice and pharmaceutical dispensary will be permanently changed? Do you see that behaviour in terms of the reluctance to go into hospitals, which I know in China are not necessarily, kind of the easiest places to access anyway? Do you see this as being a permanent change?
It's going to be permanent. I think the impact of this is quite profound and far-reaching. It really creates enormous opportunities. First of all, we saw that the Chinese public is really turning into online health in a very big way in the midst of this crisis. For example, a very large number of customers who choose our platform for all the services have been retained, even when this outbreak start to improve. The number of users, for example, cardiovascular, endocrine, and neurological chronic diseases increased by 3 times, and they are all retained.
So when you talk about the delivery of personal protective equipment, and you're delivering them all across the world, right? Where are you seeing the biggest demand and need at this point?
We see the demand is everywhere. Certainly, when the outbreak was severe in China, we delivered nationwide to Wuhan City, to Hubei province, and to everywhere in China. But when the outbreak started to improve, we saw a huge demand from overseas, and we start to deliver to hospitals in New York, to the Washington State, and even to Amazon, among many others. So we launched, first of all, we launched free consultation service on March 17th to people abroad with our online hospital. Then we launched on March 27th, we launched the overseas service to provide direct delivery of PPEs, including face masks, disposable gloves, protective gowns, and many other equipment for personal and community safety. And we deliver to 237 countries and regions across 5 continents, including the hard-hit countries by the pandemic. Yeah, U.S., Italy, Spain, U.K., and Japan, and many others.
So when it comes to this health sector, medicine, it's been a very tightly regulated market, and of course with good reason, because this directly affects people and their health and safety. How much support have you been getting from the government in actually allowing all of these online medical services to be performed, even like drug refills also to be given out?
Oh, yeah. So first of all, we see a trend. Online plus offline healthcare is going mainstream. Okay, there's every sign that online plus offline healthcare is enabling China to make up for the gaps in the existing system, particularly in primary care. We also see that there's a growing support from government. During the about 2 months time frame, it was never before. The Chinese government has released 5 policies just within 2 months of time frame, all supporting internet healthcare, including the very newly released guidance on the promotion of internet plus Medicare insurance services, promoting the reimbursement of qualified online medical consultation services and e-prescription filing for revisiting patients. So certainly we believe the success of online and plus offline model during the COVID-19 crisis will have a lasting imprint on China's healthcare system. So we believe that we are heading in the right direction.
On China, I know that you've launched the platform to provide PPE outside of China. And is this challenged, your international ambitions? Are they being challenged by, the sort of diplomatic route that Beijing finds itself in over the handling of the coronavirus, the cover-up at the beginning, and just these fights that we're seeing it have with other countries at the moment?
Yeah, so we are a technology company. Our business model is called the T2B2C. So we use technology to enable businesses to better serve customers. So right now in China, we already have the largest virtual pharmacy network, serving over 235,000 pharmacies in China, representing more than half the market. So certainly our first strategy is to further scale up our business with this T2B2C strategy and our omni-channel e-commerce platform. So in the next 3 years, we probably still focus domestically in China. Our goal is to connect, probably more than 400,000 pharmacies, clinics, and hospitals, provide all the online consultation, diagnosis, drug prescription, and chronic disease management services for over 100 million patients, directly and indirectly. Also, at the same time, we enable pharmaceutical companies, probably more than 1,000 mainstream pharmaceutical companies, to assist them to reach more patients across the country. Certainly, we'll invest more in technology. We call ourselves a technology company. We'll increase our investment in technology, right? We're not only boost our own operational efficiency, but also deliver value and efficiency to our ecosystem partners. We are already global, although in a small way, but we'll continue to find various ways of going global.